Careful management of medications and nutrition can have positive effects on a patient's comfort towards the end of life. Although there are no specific rules about what medications should be stopped, ones that are more relevant to symptom management than health promotion are usually prioritised.
Common medications that we may stop in the terminal phase would be things like oral hypoglycemic agents. Patients aren't having any nutrition, so we're not going to be giving them things to lower their blood sugar. A lot of cardiac medications, blood pressure medications would be ceased at end of life, and actually probably most oral medications would be ceased because there's no way for the patients to be able to take them.
Because patients can find it difficult to swallow as they get closer to the end of life, nutrition can also be difficult to manage. As a patient goes into the terminal phase, the body starts to shut down, decreasing the need for nutrition. Often the patient loses their appetite and their energy requirements are less. It can therefore be more beneficial to the patient's comfort to lower food intake, something that can be difficult for family and friends to understand.
The need for hydration and nutrition is one of the most commonly asked questions from relatives, and it often takes a lot of education and explaining that the patient probably doesn't need what we feel that they need.
Hydration is also a difficult area. There is a fine line between keeping the patient comfortably hydrated and overhydrating them, which can lead to other complications of its own. Mild dehydration can sometimes treat certain terminal symptoms. For example, mild dehydration can reduce cerebral edema, which may allow the patient to regain lost cognitive function.
Hydration is a big issue. Yes, everyone needs to be hydrated to an extent, but it's a fine line in keeping somebody well hydrated but not overloaded with fluids on a body that's failing and slowing down. Sometimes by introducing fluids either, and this is commonly seen in the acute setting if patients have IV fluids, sometimes they can overload a very sort of a poor, compromised condition of the patient anyway, so it can often lead to more problems such as the build-up of fluid in the lungs or get peripheral edema in the legs or the arms, so it's a fine line.
Medications and nutrition should be managed to maximise patient comfort and dignity. Medications relevant to symptom management are usually prioritised over those that promote health. Nutrition and fluid intake is influenced by many factors, including the patient's physical ability to swallow, their appetite, and energy requirements. Hydration levels can also be manipulated to relieve certain terminal symptoms.